welcome to all of you who are joining us tonight. Yay for the hospital workers. I want to stop and pause and honor all of you for sure for all the work that you've done for the province of Ontario, for your patients, for your families, for other families. You've showed up every single day over the last year. You always have, and we know you're always going to, even post-COVID. So I just want to stop and thank you so much for what you've done, and I couldn't be more prouder to be head of this union and to be your voice wherever I can for hospital workers. And this is a really important time because we're about to enter into bargaining and demand that your employers give you the respect and the protection and the pay that you deserve and have deserved for a long time. Some of you have heard about the campaign. It was launched early on this year at International Women's Day, and it was very relevant that we did it on International Women's Day because, as you know, this pandemic has disproportionately affected women, and we are predominantly women in the healthcare sector, and ironically, even some of the people that we take care of in home care and long-term care tend to be predominantly women as well. So we had a message for the government on International Women's Day. We carried that into the budget where we demanded the respect and the protection and the pay be included in their budget. We've all seen the Premier stand up on a daily basis and tell you personally how much he respects you, that you deserve all the protection and that he's got adequate PPE available and that infection prevention control programs are all in place. And then that he sees that you deserve much more wages and staffing support, but then he never puts action to those words. So we called him to do that at the budget. And as you know, the budget was released and none of that was included. We asked that he recognize you, that he stabilize your work life, your family life, by recognizing you through the finances that were going to be distributed on the budget day. So we took that off to the Minister of Finance and we shared our feelings with him, shamed him, and said that no longer are we just going to take words from that government, that we demand some action to the words. And when you look at the words respect us, protect us, and pay us, what I like the most is that that is so relevant right now. It is in your lives pre-pandemic and it will be after. You so deserve respect. You deserve respect from your managers in your workplace, and you deserve respect by giving you partners to work with, by recognizing your value through either pay or by having full-time work with paid sick time and benefits for all, and improved benefits. I mean, I can only imagine, we had a discussion today about how we want, more massage language in your benefits. I can only imagine how you've broken your backs over the last year and the stress that you're feeling every day. So that's just some of the respect us that we are calling on. And of course, the protection, we know what your work life was like. We know that you've got, bullying and disrespect, and also there's some violence happening in all of your lives. Doesn't matter where you work. It's a rough place out there right now. You need that kind of protection, and we're looking at the future, not just the past. We still don't know the effects, the long haul effects of this COVID pandemic yet. We don't know what kind of health conditions, never mind post-traumatic stress that we're going to be faced with when this is over and done with too. So we want to ensure that your employer recognizes that there might be much more supports and your benefits needed, or WSIB. They better not be arguing about workplace protection if you have acquired the pandemic at work, which likely is the case for all of you. And then the pay us. I mean, come on. This government has obviously giving you pandemic pay in wave one. Do you remember wave one? That was now 3 waves ago that they recognized that this was going to be difficult for you and that you were going to be called to show up in ways that you've never done before. Well, we're in worse place now as we enter into wave 4. The pandemic wasn't here for only 6 months. It's been here going on over a year now. So that pandemic pay should have been there all along, and it should definitely have been there for every one of you. And we continue to demand that the pandemic pay be reinstated and that the $4 be a permanent wage enhancement for everybody. And the pay goes on and on and on, as I mentioned, sick pay, etc. So I really do love this campaign because I think it speaks to everything in your life. And just to report, since we were on the Hospital Workers Council meeting this afternoon, I met with Jagmeet Singh, the NDP federal leader, And he wanted to talk to us about our campaign. So it's gone across the country now. The Respect Us, Protect Us, Pay Us for frontline workers who've showed up every day for our loved ones. So if you do follow Jagmeet Singh on Twitter, you will see he will be talking about that soon. If you don't, then sign him up so you can see what he's saying about our campaign and about what he's saying about you and how he can help from this federal level. So I can't wait to get at this and to continue this. It's going to be our slogan during bargaining. It's going to be our campaign. We're going to be wearing more stickers and holding more signs up in our cars, driving at MPP offices, anywhere that we can have people listen to us. We're going to be there demanding the respect and protection and pay for you. Because believe me, your union absolutely does, and I know you do for each other, respect each other and want that protection and are demanding the pay. So can't wait to do this, locking arms with you. I can't do it alone. Staff can't do it alone. We need our 24,000 hospital workers to line up behind us in this upcoming bargaining, because together we will make change. There you go. Thank you, Christoph. Back to you.
Thank you so much, Charlene. Now I have to introduce your Executive Vice President, Mina Amrith. Mina, the floor is yours.
Thank you, Christoph. Thank you, Charlene. Mina Amrith, I'm your Executive Vice President, and I am from the hospital sector. I am from Sunnybrook Health Sciences Center, was a chief steward there for several years, and I am a practicing RPN for 23 years now. A few months ago, Charlene has appointed me to be the officer for the hospital bargaining. And just today, we had our Hospital Workers Council meeting with your chief steward to begin the work of bargaining. And I can tell you this round of bargaining will be very different, and I'm really excited. Stay tuned for more information. Folks, I cannot stress enough how important this round of bargaining is, especially in this pandemic. We need to have a collective voice at the table. We must come together. We are great in advocating on behalf of our patients, our families, and our communities, but ourselves. So I'm asking you, and this is my call to action, for you to please get involved. It just takes 5 minutes of your time to fill out surveys, share your vision stories, even take pictures. Just get involved. We cannot win without you. Let me say that again. We cannot win without you. So give the MRC a call to find out what you can do to help. And look, we have a government that comes on TV every day and calls us healthcare heroes. We have our employers who call us heroes. Well, at least some of the employers. They better be prepared to hear us, because on this round of bargaining, we are demanding the government and employers to respect us, protect us, and pay us as healthcare heroes. I will stop there now because I'm getting all fired up and I'm ready to go down to rally. But thank you. I will now pass it on to Matt Cathmore.
Thank you, Mina. All right, so I'm just going to share my screen. I'm going to be presenting to you the working conditions survey. So as some of you may know, we launched a survey for service and clerical members, and we had an RPN survey. So I've merged the results together, and you're going to see the presentation from preliminary results so far. So I'm just going to share my screen. Sorry, bear with me 1 second. There we go. All right, excellent. So like I said, this is a preliminary analysis of the results. We're looking at about 2,000 responses so far, as the survey is still circulating across the hospitals in hard copy. So the following presentation is based on just over 1,000 responses from service and clerical. 10% of that 1,000, so approximately 100, were also nurses who filled out the service and clerical survey, and then 564 responses came in from RPNs. And like I said, these numbers are much higher, but at the time of doing the analysis, this is what we based it on. So why do we conduct working condition surveys? Research and the with support of the internal organizing team prepares for large-scale negotiations by surveying our membership. We ran focus groups this year based on equity and inclusion and looking at discrimination in the workplace. We go through all the different facets of our organization to better understand the challenges and concerns of workers across hospitals. So obviously it's to hear from you. It's to create a narrative to inform hospital bargaining contract action campaign, which you'll hear more about. It's to create a more comprehensive understanding of what's going on each individual hospital basis. And to support us at bargaining, we use survey results to create priorities. We listen and our members guide our priorities. And then following the priorities, we do a survey to have our members rank those priorities, what's most important to them. But when we are at bargaining, or if by chance we have to go to arbitration, it's important to have statistics to support the asks. It's all about demonstrating why to the OHA in this case, why do our members need these improvements within their contract? And I'd like to say that your challenges are this province's healthcare challenges. So we looked at what were the top challenges from our membership across the hospitals. And number one, staff shortages and heavy workload. Without question, this was no surprise, especially the last year that our members have experienced. Lack of managerial support came up a lot. Unfilled vacancies. A lot of your coworkers were off in isolation and those positions weren't filled. So the additional workload was landed on you. General lack of respect. This is shared by a lot of our members, especially from their supervisors. They just don't feel appreciated in the workplace, which is unfortunate and something we want to change this round of bargaining. Not having access to tools and equipment needed, especially access to PPE. We've heard countless stories of management locking up, especially N95 masks and withholding PPE, members reusing PPE, which was a serious problem throughout this pandemic. And then poor communication and teamwork, which is something we really want to turn our attention to, and we need the members' help for this. Addressing this challenge in the workplace, creating a culture, or helping to create a culture that everybody feels safe and comfortable in. I'll be going a little bit back and forth between RPN experience because I merged the two to an initial presentation. So there are some slides that will pertain specifically to RPNs. 94% of RPNs reported that they regularly work short-staffed, and 72% of these members felt patient quality of care suffers, due to understaffing. The top three concerns across our RPN membership: inadequate levels of nursing staff, inappropriate utilization of nurses, and lack of strong nursing leadership within the hospital. As you can see on the right side of the screen, causes of excessive workload. A very small minority of workers said that they don't have an excessive workload, but you can see lack of staff, restructuring, lack of support from management. There's some key themes you're going to pick up on as I throw a ton of stats at you the next few minutes. So part of the focus this round of bargaining is really elevating the professionalization of the RPN. It's something that we haven't done well enough in the past, and it's a huge focus going to this round of bargaining. So to do that, you need to compare them directly with the registered nurses. So we looked at things like overlap, better understanding the scope of practice. I'll tell you now, I learned this round prior to this survey, developing the survey with our nursing e-board and Jackie Walker, nursing division president, that RPNs can learn the exact same skills as RNs. It's just a matter of access to that training, right? So RPNs reported, 72% reported that they can work to their full scope of practice, and just over 1 in 4 said they can't. 73% of RPNs believe that their skills overlap with RNs, and then 15% don't believe that they do. Some of the limits, we wanted to understand why can't you work to your full scope of practice? An overwhelming majority said their employer policy was restrictive. So the employers either not providing training or just their policies are hindering the growth and skill set of RPNs across the hospitals. And then 10% said that they weren't aware of employers are not aware of their actual scope of practice. So as we look to elevate the RPN profession, we wanted to know in the last 5 years, what new skills and training are RPNs learning? So some of the skills that came across, and there's a huge laundry list, and I learned a lot during this practice, but caring for unstable patients came through the most. This used to be a role that RPNs have informed through the survey results that was taken on by RNs, but due to COVID, there's not enough staff, and the nursing to patient ratios are too low. RPNs are caring for unstable patients. They're engaging in coronary care, phlebotomy. They're doing PICC lines, IV push medications and IV initiations, RAID contributions, something I had to learn about, which relates to behaviors of patients, MDS assessments, and then CVAD, central venous access devices, and telemetry. So we also learned that RPNs are working in various areas of the hospital. I mean, they're working top to bottom, but dialysis, ER, and surgery were new areas where RPNs were being scheduled throughout the various hospitals. So looking at the impact of working short, 77% of respondents, this is everybody all of our members who work in hospitals, stated that patient care was hindered to some degree due to short staffing. So you can see this theme is really propping up throughout this presentation. And 93% of our service and clerical membership work through lunch and breaks on a regular basis, which is extremely high. This last year, I mean, I can only imagine the sacrifice and try to wrap my head around the sacrifice that our hospital membership have made. So we wanted to measure the mental and physical toll experience rates across all of our hospital members. And the experience rates will take, like, the people who reported sometimes, almost always, and always to come up with a statistic that's a very powerful statistic. And as you can see, the large majority of members experience mental exhaustion, high stress rates, physical exhaustion, back pain, upper body pain. So it's actually no surprise that people, Chief Stewards on an earlier call today mentioned that they want better improvement to their massage benefits, which it makes sense. The statistics show and support that. Every working conditions survey we do, we try to focus on workplace violence. We need to understand the health and safety as through the members' eyes. 2 out of 3 members report to being verbally harassed every year. 35% of respondents have witnessed a coworker experiencing violence. 1 in 5 members experience physical assault at least once per year. And then 15% of respondents experience sexual harassment at least once per year. These numbers are way too high, and we have to put protections and safety protections in place, especially through the collective agreement, to ensure the safety of members in this round of bargaining. Inclusion in workplace. So this is something we haven't approached at bargaining. I mean, we've always tried to address harassment. We'd like to get rid of all gender pronouns, but this year we held some focus groups across the province and tried to better understand the discrimination and lack of inclusion across hospitals. So we held 5 of them, and we touched every corner of the province with our participation, and the feedback from members was overwhelmingly positive. So in addition to the focus groups, we wanted to quantify the experiences of members, and 2 out of 3, or 66.6% of members, have not received anti-racism or inclusivity training, which is incredibly high and very shocking. 1 in 4, so 25% of respondents, don't believe that the hospital creates an inclusive environment. So if, 1 of every 4 workers doesn't feel like they belong, or that the management creates an inclusive environment, which is very sad. And then just knowledge of anti-racism policies. Less than half of our members know that their hospital has a policy targeted towards anti-racism. The other half either were unsure or admitted that their hospital did not have any policy surrounding anti-racism. COVID-19, you guys have probably been surveyed like crazy throughout this pandemic, but it's important to include language and priorities around COVID-19 and any sort of pandemic to prepare for the future. Our members reported increased stress and anxiety levels to critical levels, low levels of morale, communication breakdowns. They felt unsupported by management throughout this pandemic, and increases the patient load without the staff complement. So like I said earlier, your coworkers are off because they've contracted COVID or they're on isolation, but these jobs aren't being filled. So the burden falls on all of you. So we wanted to ask, so we asked the RPNs, and of course we asked every hospital member over the past 5 years, how has your role changed? In order to make gains, you need to sometimes demonstrate like the role has become increasingly difficult, or we just want to know what new training you've received, etc. So obviously, number one, increased workload. Again, it's like beating a dead horse. It's everywhere. Less training opportunities offered at various hospitals. It depends on the hospital you work at, but overwhelming majority of hospitals aren't providing training opportunities to members. Additional responsibilities to COVID was huge. Wearing more PPE, donning and doffing, greater enhanced detailed cleaning rooms, sanitizing common spaces, and then a general fear of exposure to COVID-19. A lot of RPNs reported that they had to take on various roles of other classifications as well, especially if they were working in a room where an AGMP is common. It might not be accessible to another healthcare worker, so they would have to do a lot of like cleaning or taking out the trash, stuff like that typically they wouldn't do, while also trying to provide patient care. Technology. So the research department scans global technology in healthcare quite frequently. We like to see what's going on in other countries that may be a bit more advanced, just to see what the future may hold or what could be adopted in Canada and Ontario. The responses weren't too telling. There wasn't a lot of workers responding that there was huge investments in technology. Perhaps the hospitals don't have the capital to invest in technology, but it matters to us because we need to have very strong protection around technological advancements and impeding on the bargaining rights and the rights of workers. Some jobs in the past have been replaced by technological advancements, so we want to better prepare and improve our language around technological change in the workplace. So workers reported they engage with touchscreen computers, digital charting, iPads, tablets, laptops. Nurses are working with vital sign machines that automatically update the charting. Meditech, the medical information technology program, is commonly used across hospitals. Medication scanners, and then digital medication administration. So some of the next steps. So that was a lot of statistics all at once thrown at you. I didn't share everything. I mean, we asked over 40 questions to the nurses. So I tried to break down what would be most, what's most important for the sake of the presentation. So we're going to analyze the results on a per hospital basis so that your union representatives can better prepare with the elected bargaining committees for local bargaining, understanding what problems, what issues are going on at a hospital level. From the statistics provided in the working condition survey, then we craft priorities. So we worked with the chief stewards today to identify bargaining priorities across their hospitals. So we use the information we gained from the chief stewards, along with the focus groups, the working condition survey. It all comes together to paint a picture on what we need to be addressing in this round of collective bargaining. So once we have the priorities established, then we survey the members. You guys can prioritize them, tell us this is most important to us moving forward, or this may not be a hill to die on. And then the statistics also support issues-based campaigns, and we'll be doing a ton of contract action campaigns leading up to bargaining this year. Charlene and Mina both stress we're in this together. This is the biggest collective fight we're ever going to experience. And this is the most important round of bargaining to date. So these statistics go a long way in helping frame and guide the decision-making. And I just want to say thank you. Thank you for the sacrifices you've made. And this past year, we are working our absolute hardest to make this a successful year for bargaining. And I want to thank you, of course, for filling out this survey and listening to me for the last 20 minutes. So thank you. All right.
Thank you so much, Matt. So now it's time for our first poll, which is going to be regarding the working conditions survey. So I'm going to launch the poll now. So the question is, how do you feel after hearing the results of the working conditions survey? The results did not faze me. Less alone knowing that my concerns are shared by others. Fired up and ready to take action. So I'll give folks maybe a few more seconds to complete it. So 5, 4, 3, 2, 1. Okay, and I'm going to share the results here. So as you can tell, the vast majority, over half, 51%, say they're fired up and ready to take action, which is exactly what we want to hear. And we look forward to working with you on doing that over the next couple of months. So before we move on the agenda, I wanted to give a special acknowledgement to your executive board member for the hospital sector, someone who he has spent countless hours knocking on doors to make sure that government does respect, protect, and pay hospital workers. I'd like to introduce Andy Brake. Andy, if you can give folks a wave if you're on camera. Folks, you're executive board member for the hospital sector. Welcome, Andy. Next on the agenda, we're going to be handing it over to Jackie Walker, your nursing division president, and Matthew Romaine, who's the manager for internal organizing, to talk about the path forward. Jackie and Matt.
All right, thank you so much. There's a lot of Matts on here, and I almost called you Matt, Christoph. Thanks, Christoph. And welcome, everybody. It's so excited to see so many of you on tonight, so many new faces too, folks who weren't on the call today. So we're gonna switch it up, and we're gonna watch a little bit of a video. Can I get a head nod if that's okay? Okay, cool. I see a few nods. So I'm gonna share my screen, and we are gonna watch this video. Sound on. You know, when I saw those poll results come in, I thought, like when I saw the results of the survey, it made you hard. It's hard to think that you're going through that alone. So I'm encouraged by the folks who said, yeah, I don't feel so alone. So know that you're not alone, and that together we can really tackle this. So we're going to play a really short video about the bargaining process, because how many of you have been involved in bargaining before? Okay, I'm seeing a few hands. So we're going to play this just to catch everybody else up, okay? All right, here we go.
But she doesn't really know what that means. Meet Nikki. Nikki is a physiotherapist assistant and member of SEIU Healthcare. Nikki's collective agreement is about to expire at her hospital, but she doesn't really know what that means for her and her family. What is collective bargaining? Well, it's when SEIU healthcare members come together to negotiate a new contract with their employer. The agreement outlines important things like salaries, benefits, vacation time, work hours, and safety conditions. If a new collective agreement is successfully negotiated, we call this a memorandum of agreement. If the bargaining committee likes the deal, the union will recommend it to their members and encourage them to vote in favor of the agreement. This is called the ratification process. If the vote is yes, then the memorandum of agreement is ratified. Why is collective bargaining important? Collective bargaining is a major way to solve problems in the workplace. It allows us to continue to fight for our rights and restores the balance of power for frontline workers. Unfortunately, employers don't always want to give us what we deserve. In fact, they try to take away improvements we've already fought for and won in the past. This is called concession bargaining. Without collective bargaining and our union, we don't have an equal platform with our employer to stand up for ourselves and the respect, protection, and pay you deserve. Did you know that collective bargaining and pay equity measures significantly reduce the gender pay gap? As hospital workers, we must become a unified and collective force. This puts pressure on our employers and the government. But how? Participate in contract actions, surveys, sticker days, online activism, and more to call attention to our workplace concerns. Establish a strong bargaining committee to represent us at the bargaining table. Use our voices to fight for fairness. Nikki is excited to fight for respect, protection, and pay. How about you? We can't win if you don't get involved. Start by sharing this video.
All right, so hopefully folks found that video informative and educational. If you want to watch it again or share it with your coworkers who are not on the Zoom tonight, check out our SEIU Healthcare YouTube page and Facebook tomorrow. So hey everyone, I'm Matt Romaine, one of your managers of internal organizing. And with me tonight is Jackie Walker, who is the other manager of internal organizing and your nursing division president. And we're going to walk you through the bargaining process. A lot of people think, bargaining is, a few days at the bargaining table, but we wanted to share with you visually how you can get involved. So hope everyone's ready. We're going to show you guys a really cool visual I'm a visual learner, so I appreciate when things are visual. So, so the first one on our little roadmap here looks like a mountain is the path to your next collective agreement. So the first one is the working condition survey, which Matt Cathmore just went over the results with you. So we recently concluded the working condition survey. So thank you for everyone who filled it out. It was greatly appreciated. There was one for obviously servicing clerical and one for nurses. We made this accessible to our members, both by having it available online or if they preferred a paper copy. We wanted to truly understand your experience working on the front lines of Ontario's hospitals. So the second part in our roadmap here is currently happening as we speak. We're giving the survey results presentation. So as previously mentioned, the Hospital Workers Council that was met today, and our leadership team, so your president, Charlene Stewart, and executive vice president, Mina Amrith, who oversees the hospital sector, is committed to communicating with you throughout this process, like the town hall happening right now. On October 24th, the nursing division had their town hall and shared some of the preliminary results of the working conditions survey for the nurses in the hospital sector. Over to you, Jackie.
Thank you, Matt. So what's next on our journey, which has been described as an uphill battle? It's negotiating our terms of reference. So like Mina said, this round of bargaining is like never before. Our union, SEIU Healthcare, has teamed up or joined forces with CUPE. Anybody know CUPE? CUPE, their Ontario Hospital Council Union. So we are going to be working with them to negotiate a terms of reference. Now, who knows the saying, it takes two to tango, right? So not two unions, but it takes two parties to negotiate a terms of reference and eventually an improved collective agreement. So it will be SEIU Healthcare and CUPE negotiating against or with the Ontario Hospital Association. So let's get into what the heck is the terms of reference. So like I said, it's negotiated between the parties, SEIU, CUPE, and then the OHA, but it sets out the timelines for when we are going to be at the bargaining table, when we are going to have to exchange proposals, and it also identifies what issues are going to be brought forward at the central table and what issues are going to be brought forward at the local table. So we are definitely trying to do bargaining differently this year. We know this environment calls for it. So we hope to see some changes in our terms of reference, and already one big change, doing coordinated bargaining with the other union, CUPE. So what comes after that terms of reference? Once we know what that says and how many members can be on the committee and what that looks like, we are going to have a bargaining conference. So it was talked about today with the hospital council workers that on May 12th, there will be a gathering of hospital chief stewards, some stewards, and some health and safety committee members, because we know that we all support each other and we're a stronger team together. So we're going to have all folks at the table. And that is where those members will elect a bargaining committee. Okay, sound good? So members electing members to lead the work at the bargaining committee. Also happening with something that's very new and exciting is on May 13th, the nursing division is going to be hosting a nursing summit. And I know most of you on here, you've heard about it before, but this is the first time we've done this. And what we're going to be doing is announcing the nurses who've applied for the professional practice bargaining committee and who stepped into the gap and said, I want to share my story. I want to go public with my issues. I want to make sure that other nurses in my unit are showing up when we have info pickets or when we're wearing stickers or whatever contract actions we take. I want to make sure that the nurses are there. So that is going to be happening May 13th and 14th. Our journey still continues after that, right, Matt?
Absolutely. Thank you, Jackie. So the next step in our process is the bargaining priority survey. So what exactly is a bargaining priority survey? The Hospital Workers Council and the bargaining committee that you guys elect will develop priorities based on the working condition survey results and present that to you to prioritize your top concerns as members in the hospital sector. Once we get those results, your top priorities will turn into bargaining proposals. This is another great opportunity for you to have your voice heard and determine what we fight for at the bargaining table with the Ontario Hospital Association. So after we ask you to do that survey, Jackie and Matt alluded it to before, but we will be doing lots of things called contract actions. So what is contract actions? Just a raise of hands, how many of you participated in the March 8th contract action on International Women's Day, where we launched our Respect Us, Protect Us, Pay Us campaign? Just raise your hand. All right. Yeah. Okay, so yeah, I see a few hands there. That's awesome. So, get ready, because that's just the first taste of what we're going to be doing this year. We will be doing similar actions throughout the year to put a spotlight on the demands that you have as hospital members. There's different types of actions that we can do throughout the year. You might again be asked to wear another sticker. You might be asked to stand outside your hospital on your break to show the public what's happening inside your hospital. Or what we did last week, you might be invited to join a demonstration outside an MPP's office and rally with your car to show drivers that you pass what's happening in healthcare right now. Last week, we were also at Queen's Park the day before the Ontario government passed the budget, which we know did not have our interests at heart. How many of you on the call saw the pictures that were posted of us at Queen's Park last week?
Cool.
Awesome. All right, so the next step in our journey on the roadmap, Jackie's going to talk about local bargaining.
Local bargaining. So I'm going to ask another question. How many of you have been involved in local bargaining within in your role, and how many of you have been involved in local bargaining? Sorry. A couple of people. Okay. So again, maybe for you, this is not new, but what local bargaining is an opportunity for workers from your workplace and the rep to negotiate issues in your collective agreement that pertain specific to your workplace. So historically, some of those issues have been about wage adjustments or scheduling language, and even things like uniform allowance have been there. So that's local bargaining, and it's an incredible opportunity for you to really call to action your coworkers right there in your workplace and let them know that this is going on. How many of you might apply or might run for your local bargaining committee? Cool, excellent. Cool, awesome. So what happens after local bargaining? Or maybe not after, but what happens, another big part on our journey is the central hospital bargaining table. So you'll see behind some of the staff and our leadership's backgrounds, we have the Respect Us, Protect Us, Pay Us campaign, right? And you'll see that there's a SEIU logo, a CUPE logo, and a Unifor logo. Unifor may not be involved in the central table, but you're gonna be sure to see SEIU members and CUPE members bargaining a collective agreement with the OHA. So that's collectively over 50,000 healthcare workers. So we are building our strength in numbers by joining forces with CUPE, and at that table, we're going to negotiate hard. I remember last time we stayed up 24 hours one day and it was real intense, but we will do what we have to do to get it done.
All right, thanks, Jackie. So the next step in our roadmap is conciliation. If the unions in the OHA cannot agree on improvements on the collective agreement, the Ontario Ministry of Labour assigns a professional referee. Sorry, that was a really bad me trying to whistle as a referee. But the Ontario Ministry of Labour tries to resolve the differences between the two parties. Conciliation is a mandatory step in the negotiation process that happens before mediation or arbitration. All right, so after we've gone through the conciliation process, we, on our little roadmap here, we climb up a little further, we get to mediation. So following conciliation, we head into mediation. This is the step one in the arbitration process. It is the mediator's job to work with the unions and the Ontario Hospital Association to come to an agreement. As a coalition of unions, with us in CUPE, we want to avoid arbitration. That's why it is so important that you participate in all contract actions to put the pressure on. So after mediation, we will get to the next step in our roadmap here. And Jackie will talk about what we get to when we come to, kind of the fork in the road.
Yeah, so Matt, you're right. We're at a fork in the road and it's like, which peak are we going to try to climb up? Like Matt said, we want to avoid arbitration, but let's talk about ratification. If all goes well and the OHA agrees with our proposals and doesn't bring a bucket full of concessions, then your your bargaining committee will recommend this collective agreement to you. And this is where you have an opportunity to review the changes to the collective agreement and improvements. And if you agree, you can vote in support to accept that, or you can vote against it to reject it. So that's what the ratification process is. It's another opportunity for you to, for your voice to be heard and say, I like it, or I'm gonna lump it. So I mentioned real quickly about arbitration. So arbitration, how many of you have heard of arbitration before? It might be new for some folks, but arbitration is a process that honestly, we do want to avoid. What happens in arbitration is typically one person, which is typically one man, which is typically and historically one white man, makes a decision about and who doesn't really have any experience in healthcare, makes a decision about what you deserve in terms of increases, better benefits, your pay, your worth. And you know what? It's not always great. So that's why we're going to keep saying it and banging the drum until we're outside banging the drum. That's why we need every member on this call, and your favorite 3 co-workers who couldn't make it tonight because they're working. That's why we need you all to be involved in the contract action, because we would like to not put our future in the hands of one man. So I think at that point, we're gone through the process. This is going to be a tool that we'll make available to you. You'll probably see it online, but I'm going to hand it over now. Oh, actually, we have a polling question, don't we, Matt?
Absolutely. I believe that. So I just want to do a quick check-in. So we want to, how is everyone kind of feeling about this? I know we're not really comfortable leaving the decision of all our working conditions improvements in the hands of one single individual. I know I'm not. So there are challenges ahead, and we will only be, really successful if members like you and your coworkers who are not on this call again gets involved in this process and takes action with you. So I really hope you guys enjoyed that kind of visual. But yes, our first kind of polling question that we have for everyone is, are you ready to take action to put pressure on the Ontario Hospital Association and the provincial government to demand the respect, protection, and pay that you deserve?
I'm seeing the numbers come in, Matt. So far, we've got 94% of folks saying yes, exclamation mark. In the chat, I'm seeing Jacinta say, I am excited to participate. And we got some folks on the fence who are just like, I'm not sure yet. So keep coming out, keep educating yourself, keep engaging. Like, knowledge is power, and I'm sure it can empower you to like take that first step that might seem scary at first. All right, so I'm going to hand it back over to our hostess with the mostest, our Deputy Chief of Staff, Christophe.
Thank you so much, Jackie and Matt. Thank you for that great presentation. As you can see on the poll results, 95% of you said that you are ready to take action. So looking forward to all the great stuff we can do together. Thank you again. And as on the mountain, you saw Bill 124, which is a major consideration for this round of bargaining. So I'm going to hand it back to Matt Cathmore, who's going to talk briefly about Bill 124 and what it means to us this round of bargaining. Matt, over to you.
All right. Thank you, Christophe. And yes, you probably saw that doom and gloom cloud. All right. So getting a sneak peek right now of visual that this will be part of our bargaining 101 guide that you will all have access to. Okay, so Bill 124. This was legislation. You probably heard of Bill 124. I'm going to try to break down some myths as well about it in this quick presentation. So it was passed through legislation in November 2019. The bill predominantly targets low-wage workers and women. So it will apply to hospital workers, workers in long-term care who work at not-for-profit homes, workers in the education sector, home and community care workers. So honestly, almost 1 million workers are affected by this piece of legislation. As you can see on the bottom left, 270,000 unionized workers. The number's higher than this, but the 270,000 unionized workers relates to something I'm going to touch on very shortly. What you'll also see in the middle bottom of this PDF is October 2020, Doug Ford gave 31 deputy ministers a 14% wage increase. This is during this was right after Bill 124. In addition to this, before pushing Bill 124 through the legislature, Ford negotiated a new contract with the OPP, which is a predominantly male-dominated world. So you can see where his real interests are. The top right of the screen, I'm going to break down this 1% increase. So the bill states that you can have wages increase by 1% and total compensation can increase by 1%. So as you can see with the pie, these are educated estimations of your total compensation. So 75% of your total compensation is wages. 4% premiums, so this could be shift premium, weekend premium, benefits, so your health and welfare benefits, your vision, prescription drugs, and then your sick leave, vacation, holidays. All these come together to create what is called total compensation. And this whole package can increase 1% and your wages can increase 1%. So I'll try to explain really a basic way how this works. Say you make $20 an hour, hypothetically, your total comp is $25 an hour. If you can get 1% wage increase, that would mean $20.20. And then your total comp, 1% of your total comp is a quarter, 25 cents. Your wages go up 1% or 1%, then you're at 20 cents. So you have 25 cents less 20 cents. You would have 5 cents to allocate to total compensation. But really, you might have 3 or 4 cents because there are things that go increase with wages. So your sick leave would go up if you got a wage increase. Your vacation pay goes up. So it can get a little bit cloudy, but we're here to fight this. We are going to I'm going to touch a bit on some of the actions to date and what we need to do as a collective. There are ways around Bill 124. We're going to be getting as creative as possible and not limit ourselves to working with the confines of this 1% wage cap. We filed a charter challenge as a union. We joined with 270,000 other healthcare and public sector workers to launch that charter challenge. The government itself launched pandemic pay, which technically speaking would violate Bill 124, but they did it, so it's okay. What I'm trying to get at is that there are ways around this, and we're going to fight them on this every step of the way. We're demanding full transparency, so we've already asked the OHA to give us a breakdown of every penny spent by every single hospital, just so that we know nothing is left on the table. And then, of course, in the past with other units that have gone under or have been recognized under Bill 124, we have requested exemptions, and we always put like wage reopener language, for example, so that if it's ever repealed, if we're successful with the charter challenge, we go back to the table, or we get negotiated increases that we should have got. But this is going to be fighting tooth and nail. So really quick, I know we're very short on time. I want to touch on 2 things: political action, contract action. Political action is something we're going to be engaging in. We're going to be providing you avenues to reach out to your MPPs, whether it be through social media, through sending them email blasts, or through even picketing, rallying outside of MPPs' offices. This is kind of both political action and contract action. So if you want to know why politics matters, well, legislation like Bill 124 reinforces that. So we're going to be, as a collective, we're going to be holding events. I don't know if you guys saw last week with the launch of the provincial budget. We did a caravan at Queen's Park, which was very well attended. It was amazing. So we're going to be doing a lot of these things leading up to and throughout bargaining. And I just want to close with this, that this is going to be the biggest uphill fight we will engage in for years to come. Just because the government implements legislation doesn't mean that we can't find ways around it. And we're going to fight. We need to fight together in order to counteract this ridiculous piece of legislation. So sorry, I tried to keep that fairly short, and we have 1 minute. So sorry, thanks for that.
Thank you so much, Matt. So to wrap things up this evening, I think we'll definitely take a minute or so. I know we're going to go into overtime here to answer any questions that you may have from the chat. But before we do, I'll throw it back to Charlene quickly to talk about vaccination.
Thank you, Christophe. I was busy chatting away there, knowing that the minutes are ticking by. Anyway, as I'm sure you all know, vaccination is the way that we're going to get COVID-19 behind us and go back to whatever the new normal is going to look like. And SEIU 100% supports the vaccination of everyone in Canada eventually. I can't wait to get mine done. My family members who work in long-term care have had their vaccine, and I thank God the minute that they got it. So we're hearing a lot still about vaccine hesitancy. And your Chief Stewards had a wonderful presentation this afternoon by a fellow healthcare worker, simple language, talking and answering questions. So we want to hold a Facebook Live, so watch your emails, join us. You can ask your questions. We want to get as much information out to people as possible. I'm frustrated with the government because they botched this up too. It hasn't been easy for seniors and others to get their vaccination, including you on the front line. But we're going to make up the gap by holding our own information sessions. So it's really helpful when the government says to me, well, your members aren't getting the vaccination, therefore we're going to make it mandatory. I keep pushing back and saying that's not the way to go. It definitely should be voluntary, and you should be providing all the information that they need to feel competent to line up and roll up their sleeves. So these surveys help me when I'm speaking on your behalf. So we'd be really thankful if you filled it out. And if you have any information that you can share with us that'll help us encourage your coworkers to get it, and for me to respond to the government and the employers, ship us off a message either to SEIU, the Member Service Center, your reps, or to my Office of the President account too. But there you go. Thank you. And get your vaccination.
Thank you so much, Charlene. It looks like a lot of our participants tonight have, so far, 73% say that they have gotten their vaccine, and 88% say, or 89% now say that they are planning to get their vaccine. So, sisters and brothers, thank you so much for joining us today. I'm just kind of quickly scanning here the chat, and I think Charlene has directly answered most of the questions I see here. And a lot of you are questioning for copies of this material, and Jackie and Matt and their team are working hard to get physical copies out to the units. And like we said at the onset of this meeting, this is going to be just the first of many occasions for all of you to join, get informed, and then take that information back to your units to empower others to act. So again, thank you so much for joining us tonight. If you have any other questions, please call the Member Resource Center at any time, and someone will respond very quickly to your questions. And also, please get involved. Look out for emails, look out at our social media accounts to make sure that you're in tune with what's going on. And thank you for all you do, and we look forward to seeing you very, very soon. Stay safe and have a great night.